Greetings! This is Case 22 with group members Labrada Callender, Marianne Colbert, Tiffany Kindrat, and Jordan Wondrak. The title of this presentation is there a connection between using health information technology and getting a flu vaccine? First, a few facts about why the flu is such a concern. Influenza, also known as the flu, is an acute viral infection which affected 18.4 million adults aged 18 and older in the United States during the 2015 to 2016 flu season. Symptoms include fever, chills, body aches, nausea, vomiting, diarrhea, and respiratory symptoms. The Center for Disease Control and Prevention estimated that 2.7 million cases were avoided during the same 2015 to 2016 period due to people getting the flu vaccine. Still, the flu kills thousands of people each year. The best prevention of the flu is to get the flu vaccine. Since February 2010, the CDC has recommended that all adults in the U.S. get the flu vaccine each year. Surprisingly, only 38.1% of adults received their vaccination from 2015 to 2016, and researchers aren't sure why so many people don't get the vaccine. This figure from the CDC website says that while the impact of the flu varies, it places substantial burden on the health of people in the United States each year. The CDC estimates that influenza has resulted in between 9.2 to 60.8 million illnesses, between 140,000 and 710,000 hospitalizations, and between 12,000 and 56,000 deaths annually since 2010. So, what is HIT? Health Information Technology Use, also known as HIT use, is defined as using the internet to keep track of personal health information. This includes online HIT activities, such as seeking health information from online websites, filling prescriptions online through your pharmacy, scheduling healthcare appointments online, communicating with a health provider via email, and participating or seeking information in health chat groups. As HIT continues to expand, it is important to research the potential impacts it could have on public health outcomes. Indeed, HIT use may actually affect getting flu vaccine. Knowing information about the flu epidemic and HIT use, our group was interested in examining the relationship between HIT use and flu vaccine uptake. We were able to use data from the National Health Interview Survey to compare rates of HIT use to rates of flu vaccines over 5 years. The National Health Interview Survey takes a snapshot of people's behaviors and gives us a good idea of what type of person is getting the flu vaccine, and if the same people who are using HIT are also getting the flu vaccine. This helps scientists and public health officials to develop hypotheses to conduct even more research and make recommendations. Using this data, we found 40% of the population in our study got the flu vaccine. Almost half of people in our study reported using HIT. 54% of women reported any HIT use compared to only 43% of men. Only 17% of adults with less than a high school education reported any HIT use, whereas 70% of adults with a bachelor's degree or higher reported any HIT use. People who use the internet to look for health information have a greater odds of getting a flu vaccine compared to people who do not use HIT. HIT users were also more likely to get a flu vaccine, even when taking differences like age, sex, race, and other factors into consideration. The results of this study help public health planners and scientists ask more deliberate questions in order to increase the number of people who get flu vaccines. For instance, a future study might survey people who are going to get flu vaccines at doctors' offices or pharmacies to see if they are using HIT to learn about the vaccine first. If HIT is leading to more vaccines, researchers could plan a targeted intervention using HIT methods like patient portal messaging or ads on health chat group websites to see if HIT use can improve flu vaccination rates. To close this presentation, we want to show you a public
Families
service
come in all
announcement from
sizes
the CDC to promote flu vaccination.
and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. Sometimes you've got an office family.
Yes!
And sometimes Team Family has got your back. But what we know is that you want to protect the people that are close to you. The flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself. Protect your family. Everyone needs a flu vaccine.